Welcome, everyone, to Hub International's virtual summit, Ready for Tomorrow. My name is Scott Fouts. I'm the Vice President of the Hub South region for our Risk Services Division at Hub International. Our next session will be on employers' obligations and liability for safety, and truly some best practices that you can do before having employees come back to work. Now, there's no doubt during this COVID-19 crisis that workplace safety has taken on a whole new meaning. Whether you're in the United States, Puerto Rico, or Canada, you'll be going through phases over the next 2, 3, 4 weeks, or even months to start to reopen. Organizational protocols will need to be based on federal, state, and local guidelines, and in some cases based on the industry the company operates in. A company's protocol will need to be flexible. Crisis management during a pandemic requires forecasting, and the plan may need to change. Constantly adjusting to that 2, maybe 3 or 4 week forecast will allow for better decisions today, but as well as make the ability to avoid being overwhelmed in the future. As you can see from the map, the US and Canada, there's still parts that are either shut down, partial reopening, or considering opening up and developing policies and procedures just to do that. Make sure that you're aligned with the local government guidelines as well as regulatory guidelines to make sure that you're doing it properly. So how do we get employees back to work safely? Obviously, protecting employees' safety and wellness and health is the top priority. Developing policies, procedures, and protocols throughout the entire company that will lay the blueprint and foundation for the coming weeks, months, whether it's 6 months or even 12 months or even 18, as you're starting to evolve, will help you not only stabilize business operations as the crisis evolves, it will also help you sustain the integrity of your suppliers and customers and community. An employer's response right now during this time is really going to be critical, not only for the health and safety of the workforce, but how well or poorly you respond may impact your brand and your logo and your business operations. No organization wants to be in the news right now with an outbreak. That's because you want to keep your employees safe and healthy, and it's also a reflection of the employment brand of how serious companies are taking this crisis. While reputation isn't the primary concern for employers, it is a potential unintended consequence if employers aren't taking the right steps to return to work safely. So how do we do this? It really needs to be a collaborative approach from all levels, from the owners and C-suite executives through managers, supervisors, employees on the ground level. You need to make sure these policies and procedures are communicated throughout the entire company and know that the health and well-being of the employee is the most important thing that you're trying to do. Provide training and guidance around that and why these policies and procedures are being put in place, and make sure that's communicated through everyone. Lastly, you want to make sure this is documented for the near term and long term, and really create a little bit of a fiduciary file, for lack of a better word, so that not only is the company protected, but if something were to happen, a loss, an outbreak, you can justify the cascade of events, whether it's training, policies, procedures, personal protective equipment that was chosen. You need to make sure that you're being able to document that and communicate that to everyone. On the other side of the slide, you see a little bit of a hierarchy model, and it's a well-known NIOSH model, and it's elimination, substitution, engineering controls, administrative controls and concerns, and PPE. And it's really a flow of effective way of saying if there's something critical operation that's an exposure, how does the employer get their arms around that to make sure the employee is protected? Now, a lot of companies are going to move to kind of a PPE analysis immediately, and you need to understand what's required of that program, and we'll talk about that in the next slide. So what are the employer's obligations for safety? Whether you're in the US, Puerto Rico, or Canada, there's an overarching general duty clause, and it basically says there's an inherent exposure in the workplace. It's up to the employer to either mitigate that, either eliminating, substituting, putting policy and procedures around it, or providing PPE. The most important thing about PPE, if you're providing that to your employees, you need to understand that you need to have a formal written program in place that outlines the need for the PPE program. You also need to understand that you have to have a PPE assessment by employee and by critical job function. They need to understand how you got to the point of requiring a mask or a face shield or gloves. And it doesn't really have to be anything around COVID-19 from the PPE standpoint, even though that's what this session is geared toward. Any company that has a PPE program, you have to show that you've done that assessment for those employees that are affected by requiring them to have that PPE. Finally, you need to provide that training, and the training kind of caps off all the documentation that you've led up to that point. You need to tell the employee why the PPE is required, how to don and doff it, which means to put on and take off, also how to maintain it or request additional PPE. Those are kind of the three pillars of the PPE program to make sure that you're protecting that resource, the employee, from those potential exposures. Employee monitoring and self-reporting. If you haven't had the opportunity yet, I highly recommend joining Carrie Shabini's session. She's my counterpart, and she'll be addressing a lot of the employee monitoring and self-checklists. Even though I'll be scratching the surface here, you need to understand what the employer's obligations are to keep the workplace safe, but also the employee to self-report and require them to go through a bit of a checklist to make sure they're coming into your facility healthy. Cleaning and disinfecting have taken on a whole new meaning. And when I say this, in the past, you probably referred to the Office of Getting Clean as an outdoor company or outsourced company is coming in to your facility and cleaning the waste baskets and wiping things down. Unfortunately, that's a proactive cleaning, but the CDC is going to require certain chemicals that are going to be used going forward. There's another part that's going to be reactive, and we'll address that in a couple later slides. But know that the reactive part comes whenever you suspected COVID-19 to be in the workplace and you're trying to remediate those things within the workplace. You're going to have to quarantine the area, have a third party come in and make sure you're remediating anything that may have been contaminated. And finally, regulatory guidelines. Again, we'll talk about that as we go through this entire session. You need to make sure you're updated with the most current regulatory guidelines that are coming out, whether it's the CDC, health and safety legislation. All those are being updated either on a weekly or daily basis. So having a team together, call it a pandemic team, you can call it a business continuity team. You need to have a team together within your organization that is making sure they're updated on that, communicating that information across the footprint. So what are our pillars of best practices? I'm sure you could probably come up with more than 8, but here's kind of what we defined as the best 8 practices as you're walking into your operation and trying to get your arms around the exposures and needed controls as we're going forward into this crisis. We'll go through each one of these individually, but understand that having a team together, again, whether it's called a business continuity team, a pandemic team, they need to get their arms around these exposures and understand what controls need to be put in place and what policy and procedures will lay the foundation and blueprint for the months to come. So what are the areas of a pandemic plan? These are probably the 5 areas of concern. Employees, whether they're part-time, full-time, they're going to stay remote. Maybe you have temporary staffing that's coming in. The concept here is you want to make sure that you're looking at the employees that are critical to your operation and bringing them back first, and then staggering them as they move forward. What that will help with is the lower concentration of employees that have to either be at work or have been at work already. You're having those controls and procedures, and it's a little bit of a control group while you're getting employees to and from. Those will also be employees that you're going to be monitoring with your employee health and safety checklists as you move forward. Logistics. I know that's a really broad paint stroke, but when I say logistics, it's anything coming in and out of your facility. It can be vendors, it could be suppliers. You will have deliveries here in a couple minutes that I'll address, but understanding that, knowing that supplies, products, any type of vendors, they're going through the same process as your company is. So understanding that if you've been ordering products and supplies 2 weeks, 30 days out in the past, you may want to make sure that's pushed out to 60 or 90 days, giving them time to make sure that they can provide the much needed services to you, and vice versa. You need to start that open communication with some of your vendors and suppliers or anyone else that has to do with moving your products to and from. Scheduling, I know it's another broad bucket here, but when you're looking at scheduling, it could be employees. It could be the logistics of your vendors and suppliers, deliveries, contractors. There's going to be a lot of scheduling. Again, knowing that there's a lot of strain on everyone else's operation trying to get back to full operation, you need to make sure you're scheduling things 30, 60, maybe even 90 days out. If you were scheduling things 2 weeks out, you may give yourself double that time, understanding that there's going to be a strain on your suppliers and vendors. Deliveries. You need to have a drop zone for your facility, whether it's office, manufacturing, hospitality, restaurant, it really doesn't matter. Everyone has some type of delivery, either FedEx, UPS, last mile delivery, all those types of delivery companies that are dropping things off, have a drop area. The CDC has provided some guidelines on how long COVID can stay on top of product, whether it's plastic, metal, cardboard. You need to understand that that area needs to be disinfected and those products need to be disinfected before bringing them into the workplace. Now, I know that's easier said than done because at some operations, you're just not going to be able to do that. Understanding where those deliveries are going to be, where those touch points are going to be, as well as communicating that to your delivery folks. That's another opportunity to understand who's coming into your facility, what their protocols and procedures are, and making sure their employees are healthy and safe. And then finally, contractors. A lot of your operations have been stagnant for the last 30, 60, 90 days. We understand that. I probably have a short list of critical contractors that are going to need to be in your facility. And I would look at it in probably three areas: facility management, maybe equipment, and then probably fleet. And I'm sure there are other areas that may be focused or tailored to your operation. But having a short list of contractors, knowing that you'll get that much needed maintenance, understanding that their policy and procedures may also have protocols for them to come in place of your business, will help kind of that forward motion of getting things taken care of and maintained at your operation. We talked about Carrie Shavini's session that really addresses employee exposure monitoring. Whether it's an app, a website, some type of form, you need to make sure that you have a way of connecting with employees before they come into the workplace. And if they have any of the symptoms that have been outlined for COVID-19, they need to have a way to report that, and you need to have a way to document it. I'm pretty scenario driven with our clients, and I'll give you a great scenario that we just had this week where an employee came to work, they were fine, they went home and they were in contact with their spouse, and come to find out they weren't feeling well and they were suspected of COVID-19. So what does that employee do? You need to have a little bit of a flipboard for that employee to call you as the employer and explain you may have been coming to some type of contact with COVID-19 or at least suspected of it. Don't have to know as a family member, it could be somewhere else in the community or what have you. The whole idea is they need to have a way and a flipboard to contact your employer to let you know they've been coming to contamination. That goes into like a little bit of a self-quarantine. But how do you as the employer have your flipboard to make sure that not only are you staying productive at work or able to create some type of shift work with that person's workload, but that person may be able to work remote for the next 14 days while they're quarantined and keep communicating to make sure they're healthy and safe. Those begin the scenarios, and it's almost a little bit of like a carousel, go up and down and round, because there will be people going back into the community, people going to work, people stopping for gas and going to grocery stores as things start to open up. You need to have a straightforward way to making sure you're communicating with your employees and documenting that. But again, I won't go in any more depth in this area because I know Carrie will touch on that during her session. So this really goes into workforce planning. I gave you that scenario to kind of set up who are your remote workers. If they can still work remote, I highly recommend keeping them remote as long as you can. Also, you may want to know what kind of equipment they'll need to be at that prolonged area of working from home, whether it's equipment setup, different products, depending on the type of business that you're in, you want to make sure they're equipped with the right products and services so they can continue being productive. The other part of that, if they're working remote and they're going to have to come in on on-site facility work, which is the middle column, you want to make sure that you're setting a place up for them to not only be productive when they come in, but have their own supplies, whether it's a stapler, pen, or if they're coming into the warehouse. You want to make sure there isn't really any communal type sharing of equipment. And ultimately, if you can do a job rotation or you can do staggered shifts or some type of work schedules to where you're offsetting and creating that social distancing, that's probably the best way to do it. But again, that goes back to your pandemic team, your business continuity team, to kind of set that up and understand your office or your manufacturing warehouse operation to make sure you're keeping the social distancing, but as well as maybe doing a little bit of job rotation. The last segment over here is on kind of those general guidelines and regulatory guidelines. I can't express this enough. Our recommendation for employers and leaders right now are to frequently update your understanding of the knowledge of not just regulatory requirements, but also medical recommendations. And highly recommend getting this from credible sources and disseminating that across your entire footprint to your employees in an accessible and pragmatic manner. Providing those timely and practical approaches to that information will not only make sure that your employees are aware of kind of the changes in the guidelines, but also your operational efforts to make sure that they're kept safe and healthy. Contractor management, I touched on that earlier, but having a short list of the contractors that are going to be in your facility and what controls you'll have over them is going to be very important. Whether it's facility management like a sprinkler riser, fire extinguishers, maybe it's a piece of equipment, or maybe it's your fleet. You need to be able to kind of control who's coming in and out of your facility, where they'll be working. Again, I'll give you another scenario. If you have a contractor that comes in and he's working on a piece of equipment and he goes home 2 days later, you get contacted by that contractor or that firm, and they say they may have somebody that's been suspected of having COVID-19, or maybe they've tested positive. That person's been in your facility. So you need to be very careful about tracking that person, understanding where they've been, and also who they've come into contact with, because that may kind of start a little bit of a flipboard of what you have to do to either quarantine an area, a piece of equipment, or notify your employees of the potential of the contamination. So workplace hygiene controls. The next couple of slides, we're going to go through different workplace hygiene controls, but really understanding just good hygiene in general, and easier ways that you can do that really are cost effective. But the main one is understanding the etiquette of the office and going forward and making sure that's communicated to employees. Whether it's training materials, maybe it's a checklist for employees, maybe it's just proper signage, just as a reminder. Be careful, because people are going to cough. They're going to sneeze. This is just kind of the natural body makeup. But understanding that, what controls are in place to do that, the hand wipes, the sanitizers, things along that line, limiting face-to-face contact. And finally, I think travel. A lot of folks are trying to get back to normal. I would try to limit travel just because those employees become a higher exposure when they're going into other folks' offices, places of business, and to other states. You need to make sure that's part of your workplace hygiene, to make sure if you're traveling, to keep those folks out of the office, because once they come in, that's that potential contamination standpoint. So here we have some engineering controls. Whether it's a no-touch door opener with your foot or your arm, those are all good ways to kind of promote that health hygiene in the workplace. You probably, if you're working in an office area, you've probably seen that kind of open air, kind of communal feel of the new office era age that probably rolled out 3 or 4 or 5 years ago. A lot of offices moved into that. The problem is that's an open air area, and it's really hard to control. So the picture there on the far right, you're going to see those cubicle partitions that still give the feel that it's still open, but provide a little bit of barrier and a little bit of protection for each of the employees. And then finally, you see that kind of the reception sneeze guard. This is kind of permanently built in. They do have temporary to where it's almost like a shield that sits up on the counter. But ultimately, these barriers and this type of equipment and devices will only protect the resources of your company. That most important resource are. Here's some additional workplace hygiene tools. Obviously, the hand wipes, making tissues available to grab doorknobs, things along that line. Here's a little key lock, able to hit elevator buttons, lock doors, open doors. The whole idea provides a little bit of a no touch so that your hands aren't being contaminated. One of the best engineering controls you can do right now to kind of curb behavior are administrative controls like this. I know this is some simple way to kind of look at it, but take an area office map or manufacturing or your warehouse or your restaurant, whatever it might be. And the easiest way to curb this out, take example of the bottom right-hand box here shows a meeting room. Usually you have 10, 12 chairs in there, or 8. Maybe you X out or take 4 or 5 of those chairs out to automatically curb the behavior of individuals wanting to go in there and sit down and work. We're trying to curb human behavior and promote social distancing. So maybe there's an area that you have to walk through and follow errors. Maybe you can take out chairs or X off rooms and communal areas that no one will sit down. The whole idea here is, as you're pushing forward, you need to curb that human behavior, and we're living in a new norm where that might just be what you have to do. We talked about providing signage on the last slide. You need to make sure this is an ongoing effort. Providing signage makes employees aware, whether it's making sure they're wearing their mask, social distancing, even the next on the floor. If you've been into a store lately, a grocery store or Walgreens or Walmart or something like that, you've probably seen the little blue X's on the ground, or someone putting, please stand here, the next person. The whole idea, this promotes the idea of curbing that human behavior and what we're used to the old pre-COVID-19 time, is to get as close to everybody as we can and hurry up and check out, or hurry up and get into the office. Maybe it's your waiting room for your visitors, depending on what type of operation. Maybe you take out chairs. Maybe you put signage where people should be sitting. The whole idea is the more communication you have, signs, things along that line will only promote that social distancing. Cleaning and disinfecting, another part of that workplace hygiene. Again, documenting that self-help or self-health assessment with employees and following guidelines are going to be the most important thing that you can do. You want to make sure that you're doing that up front and after. The communicating and educating part of it, you may need to communicate to employees what chemicals are now being used in the workplace. That's probably going to change a little bit. Or if something does become contaminated, what is your flipboard to explain to them what happened, who's been exposed, and what your plans are to make sure that that area is quarantined and clean. So there's going to be a difference between kind of proactive cleaning and a remediation cleaning. On the far right, you're going to see some of the common areas. There's going to be a little bit more higher traffic, whether public entryways, elevator buttons, copy rooms, things that everyone's going to kind of use. You need to make sure that these are cleaned a little bit more often or more frequently to make sure that you're doing your due diligence as the employer to have everything clean and sanitized. Again, when you're thinking about kind of COVID outbreak or where you're quarantined, that's going to be a third-party remediation company. And you want to make sure that that's documented and kind of throughout the whole process. We talked earlier about the fiduciary file, building that up to show your due diligence that you've done everything you can to make sure you have a safe work environment. That's going to be a really important part of that process. You've heard me talk about regulatory guidelines pretty much throughout every slide here. There are several considerations for employers as they are considering returning employees to the workplace or continue to manage employees who maybe have been working the entire time. Each federal agency charged with health and safety of workers issue new guidance either daily or weekly or every other week regarding employee relations and business operations based on COVID. You really need to make sure that your pandemic team and your business continuity team are on top of that and have the latest information. We can definitely provide you from a hub risk services standpoint some of those regulatory guidelines and push that out to our clients. But ultimately, you want to make sure that you're in touch with those websites and make sure they're credible resources as you're developing your plans. These evaluations of your assessment, your plan and response and evaluate are going to be ongoing. I've used the word pandemic plan, team committee, business continuity team. The ability of your organization to anticipate and prepare and respond as you're moving forward is going to be very important. If you also have the opportunity, Beth Anderson from our organization resilience team, their whole portion of their segment will be around business continuity and pandemic plan. As you're building the framework and foundation moving forward for the next 90 days, 120 days, 6 months, maybe even a year, you want to make sure that you have a way to assess what you're doing and be a little fluid and respond as things are kind of evolving throughout the crisis. Ultimately, that evaluation process will not only put you in a better position today, it's going to put you in a better position as you're going forward during the event. The last slide here is on business continuity. Again, I won't go into it in depth. We'll talk about Beth Anderson, who's part of our OR team. She will go in depth about what you can expect from a business continuity plan, how to develop one, and how to engage our organization resilience team to learn more about it. Our OR team is headed up by Ray Monteith, and there are trainings that we have kind of across the footprint that we can provide for different operations that would not only outline what a business continuity program looks like, but how it's ever evolving and how to look at those critical functions by department. A lot of companies are looking at this as a pandemic plan. Here in the South region, we're getting ready to walk into hurricane season. We look at all risks from a business continuity plan as like an all peril or all hazard assessment. You really need to look at a business impact analysis to really understand the exposures and the critical functions for your operation. Again, I know this is kind of more centered around a pandemic plan. You get into the business continuity plan, you see kind of that life cycle. It is an ongoing plan and should be fluid and change. But having a blueprint for that operation right now and what it will look like now versus in the future at COVID-19 will change. I really appreciate the opportunity to present my section on employers' liability. and really the best practices that we can bring to the table to get everyone back to work safely. On behalf of Hub International and our risk services team, I hope that you are safe. Please let us know how we can support you in the future. And I thank you very much for this opportunity to speak with you today. Thank you very much.